Heading back to school, we know in a couple of days. If you don't know already, completed their physicals, that's something that every family needs to think about. And sports and family medicine physician Dr. Nathan Falk joins us this morning for our Healthy Living House Call, sponsored by Florida Hospital. Dr. Falk, good to see you this morning. Thanks for coming in.
Yeah, thanks for having me.
I know this is a busy time of the year. What is the difference for a lot of people out there that may not know between a sports physical and a school physical with the annual well child visit?
Yeah, so that's a really good question. It can be confusing for parents, and honestly, when someone comes in, if they haven't communicated, what their needs are for the kid, it can be a little confusing for the physician sometimes too. We always recommend you, if you know what you're coming in for, that you kind of talk about that up front, because there are different forms. The school physical, to start with, this is the annual Florida yellow form that is sort of infamous around the state of Florida. That's the one that we use for school physicals. And the purpose of a school physical really is so that your physician can communicate back to the school about things that will impact educational needs and health and safety of your child back to the school. So do they have asthma? Do they have ADHD? Do they need EpiPens? Something like that at school in the nurse's office. And then one of the other big things is vision and hearing screening, and things that we sometimes catch that parents have no idea may really be impacting that, their ability to learn and be safe in the classroom.
And I know, having a couple boys, we've been through a number of sports physicals, and there you're looking for little different things in terms of concussion has become such a big one. Also, heart, because we hear a lot about athletes that don't know they have a heart issue until they go to the doctor.
Yeah, and sports physicals really are a little bit of a different focus, as you mentioned. Really, there we're looking for life-threatening things, and we're looking for kind of that ability to figure out who might be safe to play what sports, really focusing on heart, lungs, and concussions has become a big focus here recently.
So if a parent is watching right now, what do you tell them in terms of deadlines, or what should they be thinking, knowing that, we're about 72 hours away and their kid's going back to school?
Yeah, so the American College of Sports Medicine does recommend that those sports physicals, you try and get them done about 6 weeks ahead of time. Obviously, we're a little bit late for that unless you're playing more of a winter sport.
Sure.
Part of the reason for that is, honestly, if we catch something that needs further investigation, we always hate to hold up someone's clearance for sports so that they can't start the season, because it can take, if we need a cardiologist or an ultrasound of the heart or something like that to get those things done, can take a few weeks.
Appreciate you coming in, and I know you've got a lot of questions. Dr. Falk's going to stick around, and we appreciate that as well. They'll answer your questions about back-to-school sports physicals and school physicals as well. If you do have something to ask, all you have to do is go to our website, fox35orlando.com/health, and post your question. We're going to check back in. Dr. Falk will answer some of those, and we will talk to him about some of the questions and answers that we've seen this morning. Very little question about the weather, though. We know